Hey everybody, my name is Mario Martinez and this is Amateur EMS. So today we're going to be going over practice questions for the AEMT new National Registry Test, and I'm going to be showing you how you can access these and going over the basic breakdown of them. So you can just go to the NREMT.org website, you can scroll down to About the Examinations, and then if you scroll down, go past this, over to the click here for the AEMT items, you can see that the National Registry actually gives you some questions. Now, the issue with this is that it's not going to tell you whether they're right or wrong. We're going to work with them together. There's potentially a chance that even though I'm working with you guys on this, I myself might get one of the answers wrong, but I'm going to go through my basic thought process on it, and hopefully you'll be able to pick up something from this. I promise it should be helpful if you're struggling with the AEMT test. Okay, so I went ahead and I skipped the tutorial to go straight into the first question, and I'm going to leave a link in this description that's going to be going over more of my testing process about a previous video that I've done that should help you kind of get into the right mindset of how you should be approaching these questions. We generally want to increase our odds of successfully clicking the right answer choice. So we don't necessarily need to know the right answer, but we need to know what the wrong answer is. So right off the back, we have a 40-year-old patient who fell from a roof and is unresponsive. So really big deal. This part right here, it doesn't really matter too much. They fell and they're unresponsive. That is pertinent. The age, I don't really care too much about it. Their vital signs are the BP, the blood pressure, is 190 over 110. The pulse is at a 44. The respiratory rate is at a 28. They're sitting at 91% on room air. What is most likely causing the vital signs? So before anything, we need to be able to tell us or ask ourselves, what is wrong with the patient's vital signs? Now, if you don't know your baseline vitals, you do not deserve to pass the National Registry. You have to be honest with yourself. And I would encourage you to pause the video, write down what you think the baseline vitals are for everything. So your blood pressure, your heart rate, your respiratory rate, your SpO2, your temperature, and your finger stick blood sugar, and even your ETCO2 levels. You should pause, write them down on a piece of paper, and see what you think that your baseline vitals are, what are too high and what are too low. And then follow with me from this point forward. If you don't do this, you're not putting honest effort into practicing for the test, and you're not really going to learn much from this. So right off the back, we can see that the blood pressure is elevated. It's past 140 on the systolic and it's past 100 on the diastolic, so both points are elevated, so this is bad. The heart rate is low. It's below 60. Their heart rate's at 44 right now, so that's also bad. Their respiratory rate is elevated. It's past 24 breaths per minute, so this is bad. And their SpO2 is at 91%. Which is also bad. It's below 95 or 94% depending on your text. But the National Registry is not going to trick you in any way. If it's going to be low, it's going to be below 94. So right now it's at 91%. So this patient is presenting with Cushing's triad, where they have irregular respirations, they have bradycardia, and they have widened pulse pressure or an increased blood pressure. Cushing's triad is going to lead towards increased intracranial pressure. So I believe that the correct answer is A, increased intracranial pressure. So we're going to go ahead and move on to the next question. All right, for this next question, it says, which of the following options best explains the pathophysiology of emphysema? Select the 3 answer options that are correct. So whenever I would see a question like this, I would think, man, this is a pain in the butt. Holy moly, how am I going to get this right? So we need to do some deductive reasoning, which is very important, especially on these new types of tests. So the first part, whenever I see emphysema, I think of pink puffers or barrel-chested patients. I already know off the back. And before I say this, please pause the video. And then once you made your answer choices and you've done your own type of deductive reasoning, I'm going to show you mine and we're going to see if we can match up, okay? So I'm assuming you paused the video and you picked your answer choices. Otherwise, you're not doing an honest attempt of trying to practice for the AEMT test. And that's kind of on you. So right off the back, looking at these answer choices, I already know that it's most likely degeneration of alveolar walls. I most likely know that it's low pulmonary elasticity just because whenever you have an emphysema patient, they lose the elasticity in their lungs, specifically the alveolar tissue, because air gets trapped inside because of excessive smoke use or smoking too much cigarettes. So you can kind of see this with these type of patients. Now the question is, what is the third answer choice? Because we need to get this all right or it's all wrong. So by looking at these answer choices, I see that one of them is oxidative stress. I think that that's a cheap answer choice. I could see how possibly that's right. I could also see how possibly that's wrong. So in my head, I'm going to put like a little squiggly line, or if I have a piece of paper, I'm going to put maybe a question mark, and I'm going to move on from there. Excessive mucus production, I know that that's more than likely going to be in a patient that has asthma or a patient that has an allergic reaction. They're trying to remove the foreign substance that's causing the irritation, and that it would more than likely be in an emphysema patient. So I would cross this out in my head. I would mark in some way, especially if you have a piece of paper, that it's not B. And so mentally, this would be crossed out. Is it D, reduction in surfactant? I like that answer choice. I'm not sure if it's better than oxidative stress. And this is me being honest. I legitimately don't know if it's better than oxidative stress, but I would generally pick this answer choice. But before I'm going to go to next, I'm going to look at all the answer choices, which is something you should do. And I'm looking at hypoxic anemia or lack of oxygen caused by a low red blood cell count. Personally, this doesn't really match up with emphysema in my head. It doesn't make any sense to me. I don't see why I would pick that, so I would cross this answer choice out. So now I'm left with either oxidative stress or reduction in surfactant. This is extremely important that you do this in tests, because now I've increased my odds from a 25% chance to get it right to a 50% chance to get it right, which is huge, because you only need to push out, I believe the score is like a 950 to pass these tests. So I would personally pick reduction in surfactant. If you picked oxidative stress, I'm not going to blame you. I think that's a very fair choice also. But then I'm going to move on from there. I'm not going to spend any more time thinking about this question. Really quick. So now that we've gone over that question, you know what you need to do next, especially if you're doing practice questions? You need to figure out what is emphysema. We need to Google it, right? We need to see what we can find. We need to look at the causes, see it's by cigarette smoking, the symptoms. We need to look at some images maybe. We can see here that there's like a loss of elasticity, that there's large air pockets. And you generally need to take the extra step and research what type of practice questions you're doing to figure out what's right and what's wrong. Don't just do 100 practice questions in 30 minutes or 60 minutes and think, oh, I'm ready for the test. If you're knocking out practice questions that quickly and you're still having trouble, you're probably doing something wrong. You might need to revamp how you're practicing for these test questions. So that's just something that I like to do, is I like to see, okay, let's research the question more. Let's research what emphysema is. That way when I take this test, I'll be able to potentially properly answer this. Okay, for the next question, it says a 52-year-old patient has been experiencing severe chest pain and lightheadedness for 2 hours. The symptoms began while the patient was exercising and were not relieved with rest. What conditions are most likely causing the patient's presentation? Select the 2 options that are correct. So right off the back, we see a patient who's a 52-year-old male. He has severe chest pain, blah, blah, for 2 hours. Who cares about this? The symptoms began while they're exercising and were not relieved with rest. Okay, so right off the back, some of you might be confused with some of these question choices, so we're going to try to get the best options possible. So right off the back, whenever you're looking at these answer choices, you can already see that there's myocardial infarction. You should know by now that a myocardial infarction means basically a heart attack, and we would potentially be concerned about this with the chest discomfort. That's a very easy answer choice, and it should be easy for you. Now, the next one is very tricky. And if you haven't already, I'd recommend pausing the video, picking what you think is correct. We're going to go through it together, and there's a chance that even my answer choice is incorrect. But we're going to go through some deductive reasoning, see what we can potentially decide on. So The first answer choice is acute pericarditis. Now, acute pericarditis, if you don't know, it's inflammation of the pericardium, which is the sac that holds the cardiac tissue. And if we see itis here, we know that there's inflammation of the pericardial sac that holds the cardiac tissue or the heart, and it's all of a sudden or acute. Now, I don't think that this is what's causing that. That's very left field for me. So I would not assume that it's acute pericarditis. So in my head, I would scratch this out. If you don't know this terminology and you're confused, you could also put a squiggly line maybe or some way to annotate, hey, maybe it is A. Pulmonary embolism, I just don't think that this is a pulmonary embolism that they just developed randomly. Again, I think it's very out there for this to be the correct answer choice. So I would personally not pick this. Exercise-induced asthma. Now that makes sense to me. They have some lightheadedness. They were exercising and it wasn't relieved with rest. It causes chest discomfort because it's a lack of oxygen. So in my head, this is potentially the best answer choice right off the bat. The other answer choice is spontaneous pneumothorax. This more than likely happens to tall, young, thin individuals. Without trauma, one of their lungs can collapse. This doesn't really match up with my patient's age range. If you're confused with it though, if you forgot what a spontaneous pneumothorax is, then maybe put a squiggly line here. But regardless, whichever answer choices you decide, we're kind of like narrowing it down. We want to decrease our odds of picking the wrong answer choice. So for me, I would go with exercise-induced asthma as the second answer choice. If you went with one of these, again, I don't blame you. The big thing here, or the big takeaway, is to narrow down what you think is incorrect. So right off the bat, we think that acute pericarditis is incorrect. If you're confused with pulmonary embolism and spontaneous pneumothorax because you just forgot the terminology or you're not sure about it, I understand. But at the very least, let's knock out some of these answer choices. And on your own, what you need to do is Google these answer choices if you don't know them, or even if you do know them, and figure out more about these different types of disease processes. Okay, so the next question is, what is the mechanism of action of glucagon? So before we go into any of this, remember to please pause the video, pick your answer choice, and then we're going to go through some deductive reasoning together. So I'm assuming you've already done that by now. If not, you're kind of cheating yourself out of this practice. I don't really know why you're doing that. But anyway, what is the mechanism of action of glucagon? So why are we administering glucagon? Well, we administer this to a patient who's hypoglycemic, and we would consider administering glucagon if they cannot orally take oral glucose. If they're not alert and oriented, if they are unable to protect their own airway, if they're not able to swallow because we're worried about aspiration, we're going to move towards something like glucagon. But your first step, you should consider oral glucose and then rule it out depending on the contraindications. Now, there are a couple different answer choices here. Some are blatantly wrong, but even if you think you know what it is, go through each answer choice and mark them out and work from there. So, right off the bat, binds with insulin receptors. So, potentially this could be right? Like maybe it binds with the insulin receptors and it works together to break down sugar, and that way the body can use it properly. So we can put a squiggly line here if we don't know what glucagon does. That's completely fine. The important thing is to mark out the ones that we don't know, or that we know are just completely incorrect. So it decreases the concentration of blood glucose. Why would we ever want to do that for a patient who's hypoglycemic? Why would we ever want to make their blood glucose go even lower? You're just going to kill them. So this wouldn't make any sense. So we can cross this one out right away. And you're going to see you're going to get kind of like a little bit of a dopamine hit every time you cross one of these out. You're going to be like, okay, yeah, I know that this is wrong. I'm going to feel better about this test, and I'm going to be more confident, which is going to help you in the long term, because this is a long test. Stimulates the conversion of glycogen to glucose. I personally would pick this answer choice. I think that it's correct. The fourth answer choice is decreases the release of insulin from the pancreas. Now, this is just something that we don't relatively ever do. This wouldn't really make sense. I've never even heard of something like this. So in my head, I would automatically cross this out, right? So now we're stuck with either binds with insulin receptors or stimulates the conversion of glycogen to glucose. Personally, I would pick this one. But again, the whole point of this practice is to reduce the amount of answer choices to go from a 25% chance to a 50% chance, and we've successfully done that, which is something you should do during these tests. The next question is a 40-year-old patient is 20 weeks pregnant and reports of nausea, vomiting, and headaches. The patient's vital signs are BP is 142/92, the pulse is 78 beats per minute, the respiratory rate is at 22, and they're sitting at 96% on room air. Which of the following conditions should the AEMT most likely suspect? So, before we do anything, we should look back at the question. We have a 40-year-old patient who is 20 weeks pregnant. Okay, so that's very pertinent. They have nausea, vomiting, and headaches, especially the headaches. That's very pertinent. And let's look at the vital signs. So right off the bat, what is wrong with these vital signs? Please pause the video, make your answer choices, make your guesses, and we'll go ahead and continue from there. Okay. So for the blood pressure, it's elevated. It's 142/92, so this is abnormal. The heart rate is fine. The respiratory rate is fine. And the SpO2 is also in the normal range. So they're all fine. But the blood pressure is elevated, and the patient also has headaches and is 20 weeks pregnant. So there's a very obvious answer, but we're going to work from here, okay? So some of you might pick migraines because you see headaches. The patient potentially is having a migraine. That's correct. But there's a better answer choice than that. So if you want to put a squiggly line here, that's fine. This is a knowledge-based question. So there's preeclampsia. If you don't remember preeclampsia, you need to learn preeclampsia and eclampsia. That's essential for any type of EMS regarding OBGYN questions. So please Google search this, learn about preeclampsia and eclampsia. We'll go back to this. But if you don't know what the term is, you can put a squiggly line here. Hyperemesis gravidarum. This is just like puking a lot. I'm assuming gravidarum means something about like puking a lot because of pregnancy. I would never pick this answer choice. It's a nonsense answer choice. And there's gestational hypertension. So because they're pregnant, they currently have high blood pressure. But whenever they stop being pregnant, generally the gestational hypertension will dissipate after a while. This and migraines is technically, it is correct. Technically, that's the right answer. But the real correct answer is preeclampsia. This patient is 20 weeks pregnant. They have headaches. And their blood pressure is elevated. These are all hallmark signs for preeclampsia, and if you don't know this, you need to learn preeclampsia and eclampsia before you take the National Registry test. But again, we can cross out hyperemesis gravidarum. Generally, if you don't know any of these answer choices, you could consider A, D, B, and D. But even crossing out one answer choice is already good enough. But it is preeclampsia, I'm 99% sure. Okay, so the next question, which of the following details should the AEMT verify prior to administering a medication? Select the 3 options that are correct, so please pause the video before we go any further. But this is going over something like the 5 rights, and I believe they've extended the 5 rights a little bit more. But we're just going to go over this really quickly together. So the patient's identity, of course, you'd have to know that before you administer medication. The drug manufacturer, you don't need to know this. This is nonsense. The dose of the medication, that's incredibly important, so I know that that's correct. The route of the administration, that is also correct. The list of the possible side effects, you should know potentially what's going on, especially with something like albuterol with the increased heart rate. But it's not too essential just because the list could be pretty extensive. And the prescribing physician's license number, just no, that's obviously incorrect. So this is a fairly easy question that it should be A, C, and D, at least from what I'm suspecting. Now, this question is a really good question. I like this question a lot. It seems tricky at first, and this may be intimidating if you're not familiar with capnography, but it's actually extremely easy. So, we have a 19-year-old patient who has difficulty breathing after having an argument. The patient's vital signs are BP is 140/90, the heart rate or the pulse is 116, the respiratory rate is at 40, they're sitting at 95% on room air, and the ETCO2 is 38 millimeters per mercury. The patient's waveform capnography is shown below. Now, if you don't know capnography, you're going to be doing a shot in the dark. So if you need to study up on this before you go any further, I would highly recommend so. Especially just knowing like bronchospasms is usually all you need to know with the shark wave form. But also knowing your range is really important too. So before we go any further, please pause the video, make your answer choice, and then we'll continue from there. If you're not doing that, guys, then you're wasting your time. Now, right off the back, we can see that it's a 19-year-old patient, doesn't really matter, has difficulty breathing after having an argument, so the difficulty breathing is semi-pertinent. The patient's vital signs are the BP is 140/90, so we know that that's elevated. The heart rate is 116. We also know that that's elevated. The respiratory rate is at 40, so that's also elevated. So we already have 3 bad vital signs here. But the interesting thing is their SpO2 is at 95%, so they're technically perfusing properly still, even though the respiratory rate is abnormal, which is technically an improper respirations or perfusion. But they're satting fine is the important thing. And their ETCO2 is at 38, and the normal range is between 35 to 45 millimeters per mercury. If you don't know that, you're not really going to be able to answer this question, so you need to know your baseline vitals. So what does the waveform indicate? Normal morphology or abnormal morphology? And morphology is just like how is it structured, right? So you need to just basically know this. This is a knowledge check. For ETCO2, you're looking for these box-like structures where they're inhaling and they're exhaling. So this is a normal structure, right? So we also need to know about the rate, which is really weird. I've never really had a question where they've asked that, but I think it's a really interesting one. So there is normal morphology because the waveform is box-shaped and consistent. Now it is box-shaped and consistent, so we do like that, right? But we need to continue on with this question. Read every answer choice. Don't just pick the right first answer choice, because if I read this, I would probably click it, move on, and go from there. But I believe that that's actually incorrect. Normal morphology because of the rate of the waveform. Now we've suddenly opened up our minds because we've looked at more than one of the possible answer choices. And we've realized, hey, they're actually even looking at the rate of the waveform. That's insane. They're going so into detail. But they're absolutely right. So now that I've looked at B, I'm like, well, now A, which I thought was a for sure right answer, actually looks really bad now. Because now I need to worry about the rate of the waveform. So abnormal morphology because the waveform is box-shaped and consistent, that's a really good sign. But the rate is abnormal. So there's D, the abnormal morphology because of the rate of the waveform. So that's why we read all the answer choices. We don't just read one. Otherwise, more than likely, you're panicking on your test. You would see this. You would see, okay, this is normal. The ETCO2 is at 38. It's fine. But if we read the questions, if we find the abnormal vital signs, and we read every answer choice, we'd actually see it's D, the abnormal morphology because of the rate of the waveform, which is a very interesting way of looking at ETCO2. I love this kind of weird questioning, but it's incredibly obvious if you properly read through the question. Okay, so now for the next question. We have the en route portion of this question. The AEMT is dispatched to a dentist office for a 32-year-old patient who is weak, dizzy, and agitated. The time of the call is 10:15. The response time will be 9 minutes. Who cares? The AEMT is partnered with an EMT and a BLS fire department engine crew that is dispatched with the ambulance. The patient is located inside the office. There is heavy rainfall in the area, and the temperature is 42 degrees Fahrenheit, or 6 degrees Celsius. A local community hospital is located 12 minutes away, and a comprehensive medical facility is located 30 minutes away. Who cares? I don't care about any of this right now. What en route information should the AEMT prioritize for response and scene readiness? So, what are we prioritizing for response and scene readiness? Select the two answer options that are correct. So we need to be able to cut out a lot of the garbage here, right? So just looking at this, the AEMT is dispatch, like, who cares about this section right here? Who cares? Who cares? Who cares? Who cares? Who cares? Is weak, dizzy, and agitated. Okay, my patient's agitated. What am I worried about right now? Scene safety. Is my scene safe? The time of the call is 10:15. There's who cares, who cares, who cares. You need to know how to cut out this garbage. So in my head, I would be like blah 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 blah. The AEMT blah 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 blah. Skip. Cut out the garbage. The patient is located inside the office. There is heavy rainfall. What are we thinking? Watch out for the weather, right? In the area, and the temperature is 42 degrees Fahrenheit. Okay. Also, I'm worried about how cold it is outside, but guess what? They're inside of an office. A local community, blah, 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 blah. That's honestly how you should read these questions. You should practice enough that you can tell when you're being fed nonsense. So much of this question is nonsense. And again, I'm going to link to a video where I cut out the crap in questions, and it really applies here in these type of questions. And these text-heavy questions, you need to learn how to do that. So, looking at it, the time of the day, who cares? Maybe if it was nighttime or something, it's 10:15. This does not matter. Indoor location, it is fairly pertinent, right? I mean, that could potentially be the right answer. So I'd put a squiggly line here. I'd say, maybe it is indoor location. The report of agitation, yes. The report of agitation is incredibly important. You need to know that scene safety is very important. And that's just one of the first things that you need to think of en route. Do I need to call PD? I would consider it. The next thing is weather conditions, okay? And I like this choice a lot just because I see heavy rainfall. I'm prioritizing for my response and scene readiness. Let's make sure that we're being safe. The engine crew resource, we already have this set up. It's already in play. So I don't really need to worry about an engine crew coming at this time because they're already heading over here. So I would personally pick C and D. If you consider indoor location, I understand why. You should prioritize it in some sense, like, I need to know that I need to go inside. But these are just better answer choices overall, especially while you're going en route to the call. So for the next part, which of the following is an aspect of the scene that is likely to allow for more effective communications than would occur on many other scenes? So the patient is a dentist and is responsive. The patient is weak, dizzy, agitated. Where did this say that this patient was a dentist? This is garbage. Cut this out. I'm also not going to be saying to pause the video anymore before you answer it because you should just know to do that by now. If you haven't been doing it from this point forward, then there's no point in me saying it anyway. So hopefully you actually are putting in the honest effort. So the patient's HIPAA release form is likely in place. Who cares? This is nonsense. This is something that we don't have to worry about. Of course, respect your patient's personal privacy, but this is just a nonsense answer choice. Healthcare providers are with the patient on scene. Okay, so they are at a dentist office. That actually is a potential way to allow for more effective communication on scene. Close family members are with the patient on scene. There's no indication that there's family members on scene. So it's a very obvious answer choice that healthcare providers are with the patient on scene. Okay, so now we're on scene. And the patient, 60 kilograms, is sitting away in a dental suite. The patient says, "Just leave me alone now. Get away from me." Okay, so they're obviously agitated. The office staff states that the patient reported feeling weak upon arrival for the appointment, and then became confused. So what are we thinking about right away? In my mind, I see a patient that's agitated, they're confused. The first thing that I'm thinking of right off the bat that you should be thinking of is how's their blood sugar, right? And that's the first thing that I would go to. The patient had been instructed to start fasting at midnight for a dental procedure today. Okay, and that kind of confirms my suspicion almost. But we need to read the entire question because there may be more than one right answer choice. So the patient has a history of seizures, diabetes, okay, that goes more into what I was thinking, hyperlipidemia, which if you guys don't know what hyperlipidemia is, that just means high cholesterol, and recently dental pain. Medications include insulin for the diabetes that is being administered by an automated external pump, carbamazepine, I'm not probably pronouncing that right. If you don't know what this is for treating seizures, and I would highly recommend, if you didn't know this medication, to take a moment to research what the medication is, because you might see it again later in your career or during these tests. Hydrocodone or acetaminophen. So the hydrocodone and acetaminophen is another very, very interesting part of this question. Whenever you see hydrocodone, you think of potentially maybe they accidentally took too much hydrocodone. Maybe we're considering that this patient is confused because they accidentally took too many of their hydrocodones and they're going through an opioid overdose, which in that case we consider administering something like Narcan. And atorvastatin. You just need to generally know this. When you see statin at the end of any type of medication, you should think of a cholesterol medication, which kind of ties into the past history of hyperlipidemia. The patient has no allergies to medications. The patient's skin is diaphoretic, which also means sweaty. There are no signs of trauma. The patient obeys motor commands, that's very good, and moves all extremities. The patient cannot give their name, location, or the date, okay? So whenever we see that part of the question, right off the bat, you should say, okay, if this is due to low blood sugar or hypoglycemia, right off the bat, they can't give their name, location, or the date. What medication can we not administer anymore? And that medication is oral glucose. So right off the bat, I cannot administer oral glucose. The eyes are open and the pupils are 5 millimeter and reactive. Now, if you're reading this, you need to know just right off the bat, just Google really quick pupil sizes. What are too small? What are too big? If you see 5 millimeters, what does that mean to you? Do you know what that means? That generally means it's within the normal range. And in fact, let's just Google it really quick, right? So pupil sizes. So we can see here that it goes from 1 to 9 millimeters. 5, generally I would say 4, 5. Oh, okay, that's annoying. Is within the normal range. If we have somebody who's on an opioid medication like hydrocodone, or if they're on like, let's say heroin or something like that, we'd expect their pupils to be at a 1 or a 2. Their pupils are constricted. They're pinpoints. They're like peppercorns. They're not really seeing too much of the world right now, right? And if they're at an 8 or a 9, they're seeing too much. They're usually on an upper. So these won't react well to Narcan, or it won't react at all. But this is something like cocaine, meth, something along those lines, maybe like ecstasy. So knowing pupil sizes is very important for these type of test questions. The breath sounds are clear bilaterally. The vital signs are BP is 156/90. Heart rate is at 124. The respiratory rate is at 10. They're sitting at 95% on room air, and the temperature is at 98 degrees Fahrenheit. The blood glucose level is 47 milligrams per whatever this means, and the EtCO2 is 40 millimeters per mercury. So, whenever I'm looking at this, I also want to ask myself really quick, what are the abnormal vital signs? So if I'm looking at this, you should know the answer. Please pick it out and pause again before we move forward. And so we see that the BP is 156/90. We can already tell that that's elevated. They're hypertensive, so that's abnormal. Their heart rate is at 124, so that's abnormal. That's tachycardic. The respiratory rate is at a 10, so it's a little on the low side. Their SpO2 is at 95%, so this is also bad. The SpO2 is within the normal range. Their temperature is at 98 degrees Fahrenheit, and their blood glucose is at 47, so that's also low. And the EtCO2 is at a 40, and we know the normal range is between 35 to 45 millimeters per mercury, so that's within the normal range. So, which of the following findings most strongly suggest a differential diagnosis of a diabetic emergency? Select the two answer options that are correct. So, we can see that one of the answer choices is end tidal CO2 value. Now, if you know what the normal value is, you can obviously tell that that is incorrect because we know that the end tidal CO2 is within the normal range. We can look at the medical history. Does that strongly suggest that they're potentially having a diabetic emergency? Well, we know that they take insulin. We know that they have a automated pump. So yes, I would say that medical history is a great answer choice. Mental status. This would lead me to believe that they are experiencing a diabetic emergency, so I'll lean towards that. The respiratory rate is fairly low, so I would consider potentially this could be right, so I'd put a squiggly line here. And the pulse oximetry is within the normal range, so I wouldn't be worried about this. So with some deductive reasoning, the best two option choices for me would be the medical history as well as the mental status. The next question is, what are the most likely causes of the patient's current presentation? Select the two answer options that are correct. So, would we consider that it's hypoxia or a lack of oxygen? I wouldn't personally go towards this, but you could put a little squiggly line if you want. Advanced myxedema. If you don't know what this means, you can go ahead and Google search it. But if you're confused on it, you could also put maybe a squiggly line. Atorvastatin side effect. If you don't know this medication, again, you might have to put a squiggly line here, right? You don't know if this is right or wrong, but I know what atorvastatin is. You should eventually know what this means. With the statin being a cholesterol medication, that's not going to cause this confusion. Oops. So I know that this is incorrect. I would cross this out. Insulin dose management. I think that that's a huge chance of what's going on here. And fasting to prepare for surgery, I think that's a huge chance of what's going on here. So with some deductive reasoning, I know, because I know my medications, that it's not atorvastatin or the side effect. Hypoxia, I mean, they're satting fine, their EtCO2 is fine, so I don't think it's hypoxia. Advanced myxedema, I would highly encourage that you Google search this and figure out what myxedema is, and then come back and then see why these two answer choices make more sense. Okay, so now we have a new type of formatting where it says, based on the patient's findings, what is the most probable medical emergency and what is the most appropriate treatment for that emergency? Move the most probable emergency into the answer area and then move the most appropriate treatment into the answer area. So it says most probable medical emergency and most appropriate treatment. So from what I'm suspecting from this patient, I can see that I have either opioid overdose, hypoglycemia, or hypoxia. Now, right off the bat, I know that the patient's satting fine, their EtCO2 is fine, so I'm not worried about hypoxia. If you know about pupil sizes, which hopefully after this you'll have a fairly good understanding of it, you'll know that it's not an opioid overdose, even though they take hydrocodone, so you could suspect it. We know with their pupils being reactive and at a 5, we're not concerned about that. So the most probable medical emergency is hypoglycemia. And even if you right away know the answer choice or the answer, look at all the answer choices and make sure that you aren't missing anything that's obvious. And the most appropriate treatment, so you have administer high flow oxygen. I don't see a need for that. They're satting fine. Administer intranasal naloxone. This would be for an opioid overdose, but we know that it's not an opioid overdose because we know about pupil sizes. Or administer a dextrose solution, which I think is perfect for this answer choice. Okay, so after receiving a dextrose administration, the patient pulls out the IV line. The patient says, "Where am I at? Why are you doing this to me? My head is spinning and I can hardly keep my eyes open. I'm going to throw up." The patient vomits. The patient has pale, cool diaphoretic skin. The patient is not following commands. The eyes are open and the pupils are 5 millimeters from reactive. The vital signs are BP is 160/92, pulse is 130, respiratory rates at 12, setting at 95% on room air, temperatures at 98, the blood glucose is 52, and the ETCO2 is at 40 millimeters per mercury. So, right off the bat, what are the abnormal vital signs here before we continue? Well, the patient is hypertensive. The BP is at 160/92. Their heart rate is elevated. Their respiratory rate's within the normal range. They're satting at 95% on room air. The temperature is at 98 degrees, so it's fine. The blood glucose level is 52, and the ETCO2 is at 40 millimeters per mercury. So our patient is hypertensive, so the BP is elevated. The heart rate's at 130, so it's elevated. And the blood glucose is still low at 52 units right now. So we know that that's abnormal. What conditions are likely to explain the patient's continued signs and symptoms despite appropriate treatment? Move each option into the answer area to order the conditions from the most likely to least likely explanations of the continued signs and symptoms. So, what is most likely the explanation of what's going on to the least likely reason why something's going on? So, from looking at this, the most likely option is that they're still experiencing a diabetic emergency. You can tell because their blood sugar is still not within the normal range, so that's a huge red flag. Next, are we considering it to be a respiratory distress issue or a seizure issue? So if I'm looking at this patient, their respiratory rate's at 12, which is normal. They're sitting at 95% on room air, that's normal. So I'm not concerned about respiratory distress, even though they are vomiting. I would be more concerned about a possible seizure. If we look at this, their head is spinning. I can hardly keep my eyes open. I'm going to throw up, and they vomited. They're diaphoretic, and they're not following commands. They did have a past history. We can actually go back here. And if we look, I believe it is the carbamazepine. And the patient has a history of seizures. So maybe they're starting to move towards an actual induced seizure. The carbamazepine is to treat seizures, as well as just having a history of it. I'd be considering that potentially they're moving towards that. Respiratory distress, I would personally put this in the least likely option. I could see the argument, though, that you're concerned about it being respiratory distress since the patient is vomiting, but with them still satting fine, yes, I'm concerned about aspiration, but I'd be more concerned that more than likely they're leading towards a possible seizure. So, which of the following medications should the AEMT most strongly anticipate administering to this patient? This is an extremely good question. Would you consider fentanyl, which is a pain medication? No, this is more for a paramedic, and you would never administer this medication, especially to somebody who can't follow commands. This does not make sense. Narcan, well, if you look, their pupils are 5 millimeters and they're reactive, so knowing the pupil sizes is very important. So no, I would not consider Narcan. Oral glucose, the patient can't follow commands. So if you give them oral glucose, you're potentially going to make them puke, aspirate, and you're potentially going to kill your patient. That's a huge contraindication. Zofran or Ondansetron, it can help with the patient's vomiting. So the last question is, suppose the AEMT performs a reassessment. Which of the potential changes to the patient's presentation listed below would indicate that the patient's condition is improving, and which would show that it's worsening? Select the two changes that would indicate that the patient is improving, and select the two changes that would indicate the patient's condition is worsening. So, what shows that the patient is improving and which one is worsening? The heart rate increases to 140. We don't want our patient to go from a heart rate of 130 to 140. That just shows that they're going more, becoming more tachycardic. If we know our baseline vitals, we know that that's wrong. So very easy wrong option. The patient starts to follow commands. Originally, the patient was not following commands. So if we start seeing that the patient's following commands, that means their mental status is improving. That's a good thing. The skin becomes dry. They started off as being diaphoretic, but as it starts to dry, we can start to reason that, okay, potentially this is improving. If you're on the fence of this because you're, for whatever reason, thinking of like heat exhaustion, heat stroke, you can potentially leave this blank, but we can move on to the next part to help us break down this one. So tonic-clonic activity is observed. That shows that it's worsening, right? So then we're starting to move towards like seizure-like activity. We don't want to see this, right? We don't want to see any type of seizure just in general. But if we go back over here, since this is showing that it's worsening, this would actually show that the patient is improving. Well, everyone, that concludes the practice test for the AEMT that's provided by the NREMT website. We might have gotten part of a question wrong. I'm unable to tell you because they don't provide the answers at the end, but the important thing is that you're improving your deductive reasoning skills. I hope it helped. If you enjoyed this video, please like and subscribe for more. It helps a ton. And thank you. I'll see you on the next one. Thank you guys. Bye.